Researchers are actually warning that the pandemic may affect the mental health of children and teenagers more than adults during and after this period of isolation. Psychologist and CBS News contributor Lisa Damour says we should all work to prevent mental health crisis in young people. She joins us now. Welcome, Lisa. You know, you've heard the term new normal. I think the question is, what can we do to help our children during this time?
Well, we have sort of bad news and better news. I think it's become quite clear that this school year is going to be very disrupted for kids, and this is a very hard thing to stomach for them because they are already 5 months into a pandemic that has really worn all of us down. No kid had the summer they had in mind. Even simple things like hanging out with friends or going to the pool didn't happen for most kids. And I think there is tremendous anxiety about what school will look like, whether kids are physically going to school or not. I think kids are anxious about what will unfold. So the better news is that we have decades of psychological research that tell us that there are two things that make an enormous difference in terms of helping children along, and they're warmth and structure. So in all of the challenges we are facing, those are what parents should focus on, really making sure that home is a compassionate and friendly place, and that life is predictable, that there are routines that kids can count on whatever comes their way.
How important are those routines? Because I feel like as a parent, it's easy to fall into the routine of eating breakfast as late as 9 or 10 o'clock when normally they would be eating at 6 or 7 in the morning. And making sure that they're getting outside. How important is that routine?
You know, when there's so much disruption right now, even those really basic things can go out the window. So it is important to have routines, in part because it gives kids a sense of control when everything else feels pretty out of control. And routines let us make sure that things happen, like getting adequate sleep. And just to recap, little kids, elementary school kids need 11 hours of sleep a night. Middle schoolers need 10. High schoolers need 9 hours of sleep a night. They need physical activity. They need a safe and predictable place where they are studying and doing schoolwork, at a time they know they do it. They need to be helping around the house, helping in the community if they can do so. And then also they need time for leisure, time with friends. They need to have fun things in their lives right now, more than ever, really.
What's the concern, do you think, about the lasting impact this will have on children, and particularly with those in that adolescent stage?
You know, we do worry. This is going on so long, and we know that chronic stress is not good for anybody. And for kids, this is a long time in what are relatively short lives for them. And we worry about rising rates of depression, and we worry about anxiety. And we also worry about the fact that a lot of kids have been exposed to trauma. So we're keeping an eye on that. That said, parents can provide, guardians can provide a powerful buffering force for kids. And if we are safe and steady presences for our children, and if we help them to know how each day is going to unfold, even if we're having new routines week by week as the strangeness of this year unfolds, it helps kids to know what's coming, even if it's not exactly what any of us want.
And Lisa, a lot of parents, as you know, are struggling as well. At what point do you seek help, professional help? And if you can't do that, what's your advice?
So we expect a fair degree of distress right now in parents and kids. This is a very hard time. It would actually be strange if people were not distressed. It's time to worry, though, when the way that people, actually of any age, are coping with distress isn't healthy. So we worry if people are cutting others off, or if they're cranky all the time. We worry about substance misuse. We would be concerned if a person is struggling to take care of themselves, not sleeping well, not eating well, or if they become so anxious or depressed that they are having a hard time getting through the day. That's when we would want people to reach out. And right now, it continues to be the case that most clinicians are taking care of patients digitally, working with them through digital means. And what I would say is I hope everyone could have access, everyone should have access to professional mental health care. And in the absence of that, you know, the more warmth, structure, love, support, and predictability we can provide kids, the better.
All right, Lisa Damour with some great advice there. Thank you so much.